Hello, my name is LaRonda Banks, and I would like to welcome you to my presentation on the moral rights to health care. Health care is essential to our everyday living. Without good health, life expectancy is not very promising. We entrust our health to medical professionals daily without a blink of an eye. Professionals follow a code of ethics to ensure this privacy and trust. When the code of ethics is broken, it could lead to malpractice. Sometimes doctors make mistakes, whether minor or major. Professionals are held to the highest standard for the best quality of care. Code of ethics, resource allocation, and malpractice work together to ensure quality of care and professionalism. What is Code of Ethics? Code of Ethics is an organization that issues written guidelines for their employees on how they should present themselves with ethical values. Resource allocation, the process of dividing money, skills between departments of an organization. And medical malpractice is the unfair or negligent of a patient by any healthcare professional. Now let's talk about Code of Ethics and why we need Code of Ethics. A. Code of Ethics, it holds employees accountable. It tells employees what the company expectations are. It creates an atmosphere that is pleasant and positive. B. Integrity. Customers feel they are receiving the best care and that the company stands by its words. C. Preventions of violations. Following a code of ethics at a company gives the company a good name, and it also makes employees aware of their actions. D. Corrective action. Is the corrective action makes sure that all information is clear and that employees have an understanding of what exactly the company expects. Resource allocation. A. Healthcare needs. Resource allocation because of the rising costs in services. Hospitals must show how the money will be distributed. B. Attempts to limit resource in certain areas or cutbacks. C. Raises questions on who will receive funds, what other resources are available, and will the distribution be equal. The effects of medical malpractice. There are 4 effects. Number 1, rumors or word of mouth can hurt the business reputation. People will shy away from the business. They may not seek medical attention. Number 2, rise in insurance premiums. High premiums could cause physicians to move their practice. Number 3, health costs. We all have issues with the rising of health costs. And 4, defensive medicine. Sometimes it causes doctors to order unnecessary tests, sometimes because of the fear of malpractice. My conclusion. All resources, standards, and professionals work hand in hand to provide the best quality of care. Healthcare professionals are held to the highest standard when it comes to treatment of a patient and their health plan. Individuals depend on their care professionals for guidance and support. Malpractice, allocation resource, and code of ethics are resources needed for the daily functioning of the healthcare system, patient care, and professionalism. This concludes my presentation, and I would just like to clarify that all these things are needed to run the business and to make sure that everybody has equal and fair rights. Thank you.